name's Bianca Clarke and I'm a cognitive behaviour therapist at Bupa. Living with bipolar can make daily life challenging, and it can impact your mental and physical well-being and even affect your relationships. But you're not alone. Bipolar disorder affects over 1 million people in the UK. But there's a general lack of knowledge about what bipolar is, including the difference between each type. Whether you or someone you love is affected by bipolar, or you just want to find out more, we have made this video to bring you evidence-based information. Today we'll be covering what bipolar is, the different types, what signs to look out for, the treatment options, and what you can do to help manage it. Let's start by learning what bipolar is. Bipolar is a mental illness that can cause mood swings and changes in energy levels. Someone with bipolar can have long or short periods of time where their mood feels stable or normal, but these can be followed by extreme lows, such as periods of depression, or extreme highs, such as hypomania, mania, or psychosis. The pattern of symptoms will be different for every person. Some will have more highs, while some will have more lows. In some instances, you can experience symptoms of depression and mania or hypomania at the same time, and this is known as a mixed state. Living with bipolar can be challenging for individuals and their loved ones. Manic and depressive episodes can cause impulsive and sometimes dangerous behaviour. This can lead to feelings of stress, shame, and self-blame. It can really affect your daily life. Let's look at the different types of bipolar. Bipolar disorder can be categorised into two different types. You may be diagnosed with bipolar type 1 if you've had at least one episode of mania lasting more than a week. Some people with type 1 bipolar can also have depressive episodes. You might be diagnosed with bipolar type 2 if you've had at least one episode of depression, along with symptoms of hypomania lasting 4 days or more. Hypomania is when you have a period of high energy. It's a less severe type of mania and typically lasts just a few days. There are also several subtypes of bipolar. Cyclothymia is when you've had depressive and manic episodes over the course of 2 years, but your symptoms aren't severe enough to fit into type 1 or type 2. Rapid cycling bipolar can be present in type 1 or type 2 bipolar. You might have this if you've experienced 4 or more manic, hypomanic, or depressive episodes within a year. Unspecified bipolar is when you have symptoms that don't quite fit into either type of bipolar. That might seem like a lot of information, but find out more in the link below. Bipolar can look different in everyone, but no matter the classification, all experiences can have an impact on someone's life. So what are the signs of bipolar? Symptoms of a depressive episode can include persistent sadness or low mood, low energy or motivation, loss of interest in things that you'd normally enjoy, slow movements, and even suicidal thoughts. Signs of mania or hypomania can include abnormally elevated mood, irritability or aggression, increased energy or restlessness, and racing thoughts or fast speech. Mania and hypomania have similar symptoms, but mania can be more severe and have greater impact on your daily life. Someone with mania can also experience delusions or hallucinations where they might see or hear things that aren't there. Bipolar can be successfully managed with the right support. Let's look at the treatment options. Bipolar can be managed with a combination of medication and talking therapies. There's normally a long-term treatment plan put in place. The exact treatment that you receive can depend on what type of bipolar you have and your symptoms at the time. If you're experiencing a depressive episode, your doctor will probably offer you medication. This might be a mood stabiliser or an antidepressant. They might also suggest talking therapy such as cognitive behaviour therapy, also known as CBT. During CBT, you can work with a therapist to try to understand your thoughts, feelings and behaviours when you're low. It can also help you to change these patterns. If you're experiencing a manic or hypomanic episode, a doctor will also offer medication to treat this. This might be an antipsychotic medication. In addition to treatment, there are things that you can try yourself to manage it. Living with bipolar can be challenging. You might even feel out of control at times. But understanding your moods and triggers can help you to manage your symptoms. You could try keeping a mood diary. This is where you make a note of your moods, your emotions, and things that have triggered any changes to these. Triggers might include feeling stressed or feeling overwhelmed, a lack of sleep, specific life events, change or uncertainty, or other mental health issues. Keeping a mood diary can help you to recognise any patterns or potential warning signs of an episode. You can then try to avoid triggers where possible and put strategies in place for things that can't be avoided. Here are some other things that you can try to help manage your symptoms. Stick to a daily routine, find ways to manage stress, look after your physical health through exercise and a balanced diet, build a support network, attend peer support groups, and many other things. It's important to remember that there is no shame in asking for support, reaching out to a trusted friend, family member, or healthcare professional if you're struggling. Help is available and you don't have to face your symptoms alone. With the right treatment and support, you can live a happy and balanced life with bipolar. Thanks for watching. You're already taking a positive step by learning more.